I am going to put our first speaker front and center. Dr. Sulak, welcome. So good to have you.
Thank you, Sue.
Yeah, you're welcome. Let me do a little bio on Dr. Sulak. So Dr. Dustin Sulak is a traditional osteopathic physician and expert in integrative medicine. His clinical practice in Maine focuses on treating refractory conditions in adults and children. He is an internationally renowned expert in medical cannabis, the author of the Handbook of Cannabis for Clinicians, Principles of Practice, and co-founder of Healer.com, a medical cannabis education resource. He is a passionate educator and leader in the field of medical cannabis and serves on the board of directors of the Society of Cannabis Clinicians. So, Dr. Sulak, I am going to let you take the floor and demystify this medical marijuana that we are talking about.
Thank you, Sue, and thanks everyone for joining tonight. So I'm going to present for the next 10 minutes or so, and then we'll have plenty of time at the end to answer questions. And what I would like to cover is a little bit of the history of cannabis, and then we'll talk about how and why cannabis works so well. We'll get into some of the specific constituents of cannabis, the THC and CBD and some of the other components of the plant, and also the routes of administration. We'll talk about using cannabis as an adjunct to conventional treatment for cancer, and then also talk about the evidence for cannabis being used to directly fight cancer, and all in 10 minutes. So let's jump right in. So to begin with, some of the earliest recorded history indicating the use of cannabis for medicinal purposes, about 5,000 years old, and comes from China. It was used to treat senility, to increase appetite. So for many of the same reasons that we use it today. And then even if you look in the early 1900s in this country, cannabis was present in pretty much every pharmacy. You can see here, Eli Lilly had a cannabis fluid extract and a sharpened dam. This was extremely common, and it was used for a variety of purposes, including nausea and vomiting and other GI complaints. It was used for pain. And so cannabis had a mainstream role in the pharmacopoeia in Europe and in the United States throughout the mid and late 1800s, early 1900s, until it was made illegal in the United States in the 1930s. Actually, even after it was made illegal, that was marijuana that was made illegal, and there was some disconnect between the understanding that cannabis, which was present in the pharmacies, and marijuana, which is what people were smoking recreationally. There was a lot of people didn't even realize that this was the same thing, including when Congress passed the Marijuana Tax Act and made it illegal. The legal representative of the American Medical Association spoke out against this, saying, you can't make marijuana illegal. It's the same thing as cannabis. This is going to hurt our pharmacists, hurt our doctors, hurt our patients, and even our farmers. But it was made illegal and remained that way. And then that brings us to the story of this man, Dr. Raphael Mechoulam, who just passed away 2 or 3 weeks ago. He's considered the godfather of cannabis research. And in 1964, he discovered the active component of cannabis, which was THC. He also discovered a number of the other molecules, including CBD and many other constituents, and really led this field. Now, for years, even for decades, there was a lot of question around how cannabis was able to treat so many different conditions. There had been evidence going back thousands of years that it could treat neurologic conditions and infectious conditions. It could treat pain. It could treat digestive conditions, psychiatric conditions. It seemed like too good to be true. It was this panacea that could affect all the different systems of the body. And Dr. Mechoulam had a hunch that there was an important reason behind this connection. And so what was discovered under his guidance and supervision in a whole field of researchers working together around the world found the cannabinoid receptors. And so these are targets for THC. These are cell membrane receptors, like little antennae on the surface of the cells that the THC will fit into and vibrate with, that create all sorts of effects in the cells. And they found the CB1 receptors in the brain, and realized that there's actually more CB1 receptors in the brain than any other type of neurotransmitter receptor. These are all over our nervous system. They also discovered CB2 receptors throughout the rest of the body. And here you can see high levels of them in the bone, in the liver, in the lymphatics, the connective tissue. Really, this is a ubiquitous system that's present in every tissue and every organ of our body. And they didn't just stop there. They wondered, well, if we have these receptors for THC, they probably didn't evolve for the purpose of humans consuming this plant. There must be a reason why these receptors are there. And that led to the discovery in the early 1990s of the endogenous cannabinoids. These are the compounds that function almost identically to THC, but they're produced by our own inner pharmacy, the endocannabinoids. Anandamide, named after the Sanskrit word for bliss, is the first one that was discovered. And so from the 1990s on through today, there's been thousands of peer-reviewed scientific publications that have been examining and elucidating this system because it's an incredible target for pharmaceuticals. And there's all sorts of pharmaceutical drugs in the pipeline designed to interact with this system. Why? Because this system is a master controller of all of the other systems in the body. And if you can manipulate this, you have the potential to impact any disease. Literally every disease known to humankind can be influenced through the endocannabinoid system. Now, that's great that pharmaceutical companies are researching this, and there's all sorts of drugs in the pipeline. In the meanwhile, we have a plant with a very well-established safety profile that interacts with this system very effectively, and that's the cannabis plant. So the cannabis plant is considered dioecious, which means one individual plant will be a male and one will be a female. And the medicine comes from the female plants. What you're looking at here is a flower. It's a bud, we call it, or a inflorescence. It's a compound flower, lots of little flowers together. And when you zoom in on that, you can see that this structure is covered by all these little crystals. When you look even more closely at the crystals, they almost look like little mushrooms. These are oil glands called trichomes, and these things are factories of medicinal compounds. The cannabis plant makes over 500 compounds that have been identified, and more than 100 of them are considered cannabinoids, which are, again, similar to these compounds that we produce in our own body. The cannabis plant also makes terpenes, which are the compounds that give it its aroma. So if you walk by a cannabis plant, you'll probably notice this is one of the stinkiest plants on the planet. And if it, say, smells a little bit like a pine tree, that's because it actually makes something called alpha or beta pinene. These are terpene compounds, same exact compound made by pine trees, and probably one of the reasons when people walk through pine forests, they get that smell, they might feel clear-headed and feel peaceful. These terpene compounds have been shown to have therapeutic effects at levels that you can obtain just by breathing them in through the air, just by smelling them. And these are the basis of aromatherapy and essential oil medicine. And cannabis not only makes the cannabinoids and the terpenes, it also makes flavonoids and more classes of compounds that we're learning about all the time. So whatever we think we know about cannabis is really the tip of the iceberg. We're learning so much more all the time, and I'm sure that will continue for several decades to come. So let's turn our attention to cannabis and cancer. And I've just got, I put up some, sorry, before we talk about cancer, I want to talk about how do we get this plant into us, because there's so many routes of administration. And so to begin with, cannabis can be taken orally through, say, capsules, or through liquid preparations, tinctures, or infused oils. Now, there's quite a wide range of inter-individual variability in our response to cannabis. What this means is, say I'm sitting with a patient who's new to me that's never tried cannabis before, and we want to do something like help them sleep, or help reduce pain, or help decrease nausea. Well, I don't know if this person would respond to 2 milligrams or 20 milligrams. Some people might need even 50 milligrams. And so when we don't know, we can use something like this, like a tincture, that allows us to adjust the dose in very precise and small increments. So we start at a low dose, we gradually work up on the dose, and then we find what works for people. Usually there's what's called a therapeutic window, which means if this is the dose that helps and this is the dose that causes side effects, if we're kind of careful and precise enough, we can find that window. And many people are able to use cannabis with 0 side effects. So that's the oral route of administration. Then there's inhaled. And I showed 2 different ways of inhaling it here. One would be a more traditional cannabis cigarette or a joint, and this is smoked. And then over here, we have more of a medical device. This is a vaporizer. What the vaporizers can do is warm the cannabis up to a temperature where all of these little oil glands evaporate, but it's a low enough temperature that the plant itself doesn't burn. So you end up getting a warm mist of all these medicinal compounds. It's very easy on the lungs. There's no tar, there's no carcinogens. And the benefit of inhaling cannabis is that it kicks in extremely rapidly. Especially useful, as I'm sure many of you can imagine, if somebody's about to vomit, it's hard to take a pill, hard to take a tincture. One inhalation and a few minutes later, that nausea can be resolved. And then there's also topical cannabis for local issues. If it's local pain or neuropathy, skin inflammation, there's all sorts of reasons why someone may not need to take cannabis systemically and instead be able to use it just topically in a more precise way. And I'll just go quickly through some of these therapeutic compounds. THC, I'm sure a lot of you are familiar with. This is the strongest component of cannabis. It's what gives it the psychoactive effect. So it creates at kind of lower or moderate doses, it can create a euphoria. It can decrease anxiety. It can improve creative thinking, give a sense of peace or a feeling of heart opening. At higher doses, it can cause impairment. And at very high doses, it can cause side effects like paranoia, or it can even increase anxiety. It can even act as a psychedelic substance in the case of an overdose. Then there's CBD, which I think a lot of you have probably heard of. This is like a sister compound to THC that is non-impairing. It does help with some symptoms that are similar to THC. It can help with nausea, it can help with pain, can help with anxiety, and it works really well in conjunction with THC because it tends to mitigate some of THC's side effects. And then I'm not going to go through, but as I mentioned, there's hundreds, and there's probably 6 to a dozen that we really focus on clinically: THCA, CBDA, CBG, and CBN. And you'll see that a lot of these are available in commercial products. So when it comes to cancer, I think the first, I just showed some of the headlines from recent research papers. One of the first things to consider is using cannabis to reduce symptoms and improve quality of life for people with cancer. And the data on this is, there's a lot of data, and it's unequivocal that it helps. People will report usually in the range of like 40% of the people that are using opioids for chronic pain related to cancer are able to decrease their dose or stop the opioids completely. Sleep improves, appetite improves, and feeling like oneself, overall quality of life improves. This is important not just for the quality of life, but it also enables people to tolerate a full course of conventional treatment, whether it's chemotherapy or radiation. If the cannabis is able to mitigate those side effects of the treatment, then someone might be more likely able to complete the treatment. Here's one study that looked at topical cannabis. So this would be a cannabis cream used for chemotherapy-induced neuropathy, and it was effective in that case. Here's one looking at medical cannabis to treat symptoms from head and neck radiation therapy, again, with good results. Now, these aren't large-scale clinical trials with a placebo group. A lot of these are observational trials, but they reflect what we see in the real world, which is patients raving about how much this is helping them. Now, this next one points to a question that's just beginning to be answered, which is, can cannabis do more than just treat the side effects and treat the symptoms of the cancer. So this was a study that looked at people who were receiving oxaliplatin, which is a chemotherapy agent that can cause peripheral neuropathy. And what this study found was that people who were using cannabis prior to starting this chemotherapy agent were much less likely to develop neuropathy. This is because the compounds in cannabis are neuroprotective. They help prevent damage to the nerves. And so this is just one example of not just for symptoms and quality of life, but actually to prevent some of the damage to the body, to protect the healthy cells. Because so often in cancer treatment, we're trying to damage the cancerous cells but not harm the healthy cells. And so cannabis is something that we can use to help protect those healthy cells. And then getting into, as I wrap up here, one of the kind of topics that's maybe a little controversial, and I hope to be clear about what we know and what we don't know here, the idea that cannabis could be used as an adjunct to conventional therapy, not just for tolerating the treatment better, but for actually helping it kill the cancer. So when we have preclinical models, these would be like petri dish cell models and also rodent models of cancer, and use cannabis to treat those rodents, say, almost in every study, cannabinoids are able to kill the cancer cells, either to stop the tumor from progressing, or in many cases, to start shrinking the tumor or make it go away completely. Now, in all fairness, there's a lot of plant compounds that have been tested in these same rodent models that are effective for killing cancer in rodents. But then when it comes to human beings, which are so much more complex and our types of cancer are so much more diverse, many of the compounds that are effective in the rodent models don't translate. They're not necessarily as effective in human models. So just because we can do this in mice doesn't mean it works in humans all the time, but it does work some of the time. And so some of you may have been exposed to anecdotal stories of people using really high doses of cannabis as a type of herbal chemotherapy to kill their cancer. And sometimes it actually works. I've seen it in my practice. I've seen many cases where it doesn't work. But this paper here is an example of a case of a woman who had metastatic breast cancer. We just published this last year. It was one of my patients. And she used extremely high doses of cannabis in combination with conventional chemotherapy and had a response that was unexpected by her oncologist, where the cancer resolved extremely rapidly. She also used a variety of other holistic modalities, which I think were helpful to help her become more comfortable with her own mortality. So she used psychedelic assisted therapy with mushrooms and later with ketamine. She used a ketogenic diet. So this was kind of a multi-strategy integrative medicine case with impressive results. And then the last one here is enhancing the therapeutic efficacy of cancer treatment with cannabinoids. This is a review article from 2018. There's been a huge amount of resources in the research world poured into this concept. What can we do with cannabis and the compounds found in cannabis and synthetic derivatives thereof to co-administer with our conventional treatments? And I think this field has a bright future that's very early right now. And so there's a lot of unknowns. I want you to know that if somebody hands you a thick tube of hash oil and says, take a rice grain of this before bed and it's going to kill your cancer, I recommend talking to an expert, a cannabis expert about that, because it might not be a very pleasant experience, and that's probably not necessarily the case. But there is a signal here with some promising results that we'll certainly see followed up on in the literature. And so I'm going to turn it over to my colleagues now. Thank you for your time and attention.
Wonderful, Dr. Sulak. Thank you so much. All right, we're going to move on now, and I am going to bring Dr. Kimberly Park front and center. Hi there, Dr. Park. Thank you for joining us.
Hi, everyone.
Yes, and Dr. Park, she has founded Medicom, Pennsylvania in 2019. She is board certified family medicine physician and has practiced in Philadelphia region since 1996, including 17 years with the Crozier Keystone Health System. Dr. Park graduated from the Philadelphia College of Osteopathic Medicine and now practices with a foundational belief in the osteopathic medicine tradition of hands-on diagnostic and therapeutic science. Please join me in welcoming Dr. Park. All right, Dr. Park, I am going to share the screen now, so that way I'll run your slides for you.
Missing something? Are they on there? No, there they are.
All right,
All
there
right.
we go. How is that? Let me just get you full screen and you'll be ready to go.
I want to thank you again for allowing me to present. I have been certifying patients and educating them since 2019 when I opened my practice. And it's been a very eye-opening experience to see what a wonderful plant cannabis is. So if we can go to the next slide.
Yeah.
Okay. So I'm starting with how to get access. And firstly, I wanted to say, have you tried hemp products as a first option? So there are some states that don't have medical marijuana as an option. And even if if it is an option and you're a little bit hesitant to try THC, some of the products that you can purchase over the counter or by mail are good products that may also help, that can be CBD products, CBG products, CBDA products. You have to be a little bit cautious with choosing them. You want to look for products that have a certificate of analysis, because those show that proves that they've been tested by an independent third-party lab, and they have in it what they say they have in it. So it's verified. So that's very important if you're going to choose that. But definitely it's an option to try. Otherwise, if you want to jump on board and try CBD with THC, which you're going to get with cannabis, you can sign up on your state's medical cannabis registry if that's required. In Maine, that is not a requirement. I know in Washington, D.C., you can actually self-certify. But if you want to find out whether your state has a medical cannabis registry, you can just do an internet search with your state's abbreviation .gov, and then I would just add medical cannabis in there. I've tried that for a lot of different states, and usually it'll come up on the government site. You want to make sure that you're looking at the government site. You want to obtain a medical record of your qualifying condition. You want to schedule and meet with a certifying cannabis clinician. There are lots of certification mills where you can get your certification. Some of those physicians don't have a lot of knowledge with medical cannabis. So if you can find somebody that does, that would probably be the best person to see. And then obviously you want to get approved, and you should if you have a qualifying condition, and then you have to wait until you have documentation from your state. You might get it immediately if it's just printed out, or you might have to wait for it in the mail. In Pennsylvania, after I certify someone, it usually takes about 1 to 3 weeks for them to get their medical marijuana card. So next slide, please.
Having a little difficulty going there. Hold on. There you go.
All right, so as far as dosing strategies for common symptoms, with pain, it's often thought that oral doses of THC combined with CBD work the best. And it can vary. It can be a 1-to-1 ratio, or it could be more THC, less CBD, more CBD, THC. So, it varies. But usually combining it is going to work best as far as reducing inflammation and pain. If you have acute symptoms or breakthrough symptoms, using inhaled cannabis is probably going to work best. You can also, if you have, acute symptoms, you can actually inhale and take an oral dose, because the oral doses generally will take about 2 hours to work. And usually by that time, the inhaled cannabis starts to wear off. For nausea, THC dominant products tend to work the best. Sometimes oral doses below the threshold of impairment may prevent symptoms. And If you have, acute nausea, obviously inhaled may work best for symptom relief. As far as anxiety goes, CBD dominant products tend to work pretty well, especially for those without any THC experience. CBG, another cannabinoid, has been shown to work pretty well for the physical symptoms of anxiety, like rapid heart rate, sweating, any GI symptoms that you may get from being anxious. And then insomnia, generally the THC dominant oral works well, especially for longer duration. If you have significant pain or anxiety, as using like a CBD along with the THC can be very helpful for that as well, for getting you to sleep. Next slide, please. So everyone is different, like Dr. Sulak had said. Finding the right dosing plan is essential. This can be done through journaling and tracking your experience. Dr. Sulak has something called the Inner Inventory that's on his website that you can look at. It can identify improvements using a numerical scale. And methodical trials are better than random trial and error. A good clinician can help. And then starting low and going slow, and don't be afraid to go all the way. That has to do with the fact that some people, do very well with very low doses. Other people need higher doses for relief. So, just don't be afraid to try. If you need to go higher, then do that. And then the next slide. Just a schematic of Dr. Sulak's Inner Inventory. You can see that on his website. He gives, very good instructions as far as checking yourself right before you use cannabis, and again, after use, to see, how you feel, if you feel differently. It's just a way that you can track whether it's the right dose or not. If it's too much, not enough, or just the right dose. So I would definitely recommend that you look at that and use that if you do decide to use cannabis.
Wonderful. Great. Thank you, Dr. Park. Okay, now we're going to go on to our last speaker. Let me get this front and center. Couple slides here going on, so bear with me, please. What happens when I share? There we go. Beautiful. Okay. Dr. Wilson King, thank you for joining us. So good to have you. Everyone, please help me and welcome Dr. Janester Wilson King. She is board certified obstetrician and gynecologist. Oh my goodness, gynecologist, what's going on? With more than 20 years of clinical experience providing compassionate and research-driven care to patients. In 2010, she founded Victory Rejuvenation Center, a private holistic and integrative wellness medicine practice that provides life-transforming management modalities and customized medicines to patients. She provides cannabis recommendations as a part of their mission to promote health and wellness. Please welcome Dr. Wilson King. Hi there, Dr. King. Thank you for joining us.
Good evening. Thank you so much for inviting me here. And my two colleagues, you both are just outstanding. So I'm hoping I can measure up to what you did. The philosophy of my practice, I'll wait until my slides come up. The philosophy of my practice is that we are a spirit that has a soul that lives in a body. For healing and wellness, we should nourish each of them on a regular basis. I didn't say every day, but a regular basis. In the same vein, cannabis should be used as part of a holistic regimen. And this approach can optimize and enhance the effects of cannabis in the body. So a holistic regimen assesses and offers treatment plans that include the entire person, specifically the physical, emotional, mental, social, and spiritual aspects of that person. Now, since cannabis efficacy depends a lot on our endocannabinoid tone, and Dr. Sulak spoke so eloquently about the endocannabinoid system, I'm not going to repeat it, but we should include activities and foods and whatnot that will enhance our endocannabinoid system and improve our endocannabinoid tone to help cannabis be effective for us. And what I'm going to do in the next few minutes is discuss three modalities that one can easily do to enhance and feed your endocannabinoid system. First of all, basically, I'm going to say, I recommend eating real food, drinking clean water, and breathing clean, fresh air, allowing yourself to relax and take the time to smell the roses. Okay. Let me just circle back one. I want to say that I am a Philadelphia native. Go Eagles. So I wanted to say that I can relate to all the Pennsylvanians. Now, for my first slide, we'll talk about nutrition. And I just mentioned about eating real food and drinking clean water. I just want to touch on one other thing. Let's talk about hemp for a minute. It's really an extraordinary crop with enormous social and economic value, since it can be used to produce food, textiles, clothing, biodegradable plastics. Oh, wouldn't that have been wonderful if we'd used that? We wouldn't have so much plastic in our oceans and contaminating the environment. Hemp can be used to make paper, paint, biofuel, and animal feed, as well as lighting oil. Now, the difference between what is commonly known as marijuana and hemp is THC. Hemp has very low levels of THC, so there's minimal, if any, impairment risk. I'm going to speak to you about hemp as a food. Now, did you know that various parts of the hemp plant represent a valuable source of food? It is rich in, number one, biologically active cannabinoids, such as CBD, which exerts potent anxiety reducing and relief of muscle spasm effects. Dr. Kim Park spoke about CBD in her talk. Hemp seed actually has a really pleasant, nutty taste and represents a valuable source of essential amino and fatty acids, minerals, vitamins, and fiber. Hemp seed oil is a source of healthy polyunsaturated fatty acids, and hemp sprouts are rich in antioxidants. So hemp really is a good food source. It can actually calm you down. It can actually relieve muscle spasms, etc. And one of the best advantages of hemp protein, because hemp is an excellent source of protein as well, is that it has few disadvantages. There's hardly anybody who can't use it. It's a very safe food. Hemp protein powder, excellent source of protein, by the way, is generally well tolerated and very easily digested. Now, unless someone needs to be on a low fiber diet for medical reasons, such as diarrhea issues or after having gastrointestinal surgery, there's really little reason not to try out this product. If you're allergic to hemp, it's best to steer clear of hemp protein powder, but that's only if you're allergic to hemp. But for most people, it's generally safe. And I would say if you're going to purchase hemp products, just watch out for added ingredients because they really aren't needed. So enjoying hemp as a food will enhance your endocannabinoid system. There's other foods such as flax seeds, chocolate, walnuts, herbal teas, and even spices such as black pepper that also enhances your endocannabinoid system. Dr. Sulak has a very nice list and article on his website, healer.com, about foods that can enhance your endocannabinoid system. Next, I'm going to talk about exercise. Did you know that exercise actually helps you feel better? and that exercise can actually enhance your endocannabinoid system? Let's talk about that for a second. Physical exercise is considered a valuable non-pharmacologic therapy that is an immediately available, is very inexpensive, and has a lot of health benefits. I know people hate to hear the word exercise, but it really, really is very helpful for you. Exercise will cause an activation of the endocannabinoid system in your body to secrete endocannabinoids, which relieve anxiety and promotes a sense of well-being. Exercise also increases your circulation for better perfusion to spread those newly formed endocannabinoids around, to spread the joy throughout the body and the calmness that it provides. Exercise may also, the endocannabinoids secreted may play a critical role in decreasing inflammation as they modulate the activation and migration of immune cells. This alone can lead to some relief of pain. So exercise is definitely a way to feel better, change your perspective on things, and maybe have more clarity because of all those lovely endocannabinoids running around. Now, there's a little caveat. It is important to like what you are doing. So studies have shown that if you are not at all enjoying the exercise, the benefits are less. Actually, your endocannabinoid levels will not increase as much, and that's been shown in research. So find something you enjoy doing and do that for exercise, such as dancing, bike riding, boxing. There was one time in my life where I had a boxing bag in my garage where I would go out and just punch the bag. And oh, did it cause such relief. I mean, I just kept punching. It's when both my kids were teenagers and I had to relieve some of the stress, but it was very, very helpful. So definitely use exercise as an aid to your endocannabinoid system. The final discussion will be about spirituality. Cannabis has been a part of spiritual practices for thousands of years. It has deep roots in Hinduism, Islam, Rastafarianism, and indigenous traditions in Asia, Africa. Cannabis is considered by many in India to be at least as significant and respected as the wine used in Holy Communion is to Christians. Cannabis is viewed as sacred in Tibet and was used to heighten meditative awareness by Buddhists. Other Sufis, the Sufi sects of Islam, have consumed cannabis, often in the form of hashish, to commune with the divine. And religious use has also been reported among Coptic Christian ascetics in Ethiopia and in Egypt. And of course, the Rastafarians in Jamaica, who don't drink alcohol, don't smoke, but they use cannabis for any and everything. They use cannabis as a medicine, cannabis as a wellness tincture, and cannabis as a part of their spiritual practice. Now, based on the evidence that spirituality is linked to psychological well-being, and remember I said spirituality, not religiosity, the researchers of a study published in 2021 conducted comparisons on how those who did and did not report spiritual benefit differed regarding their spiritually relevant behaviors. They looked at the reasons for using it, and they used the daily spiritual experience scale primarily to measure this. The spiritual benefit from cannabis was reported by 66% of the sample. 5.5% reported that cannabis hindered their spiritual practice. And those who reported spiritual benefit differed from those who didn't, in that they were more apt to practice what we call expansiveness motivation. That's people wanting to enhance their potential efficacy, like learn a new language, do something out of your comfort zone, just kind of spread your wings a little bit. Also, people who received spiritual benefit did daily spiritual practices such as Tai Chi and yoga, things like that. Those who meditated frequently derived some spiritual benefit and assistance from the use of cannabis, meditation and prayer. And then the practice of mindfulness was a big part of a lot of the people who have received a spiritual benefit from cannabis. So folks to whom this happened were not those who were the most frequent users of cannabis either. So don't think you have to take cannabis every day in order to derive help for your spiritual practices. It's really about your state of mind and your openness to receive this spiritual benefit. So one of the questions on my intake form in my practice asks about spiritual practices, because like I said, we are a spirit that has a soul that lives in a body. And it not that I need to know that, but it opens a way for me to discuss patients' spiritual practices and just find out it helps me to find out what's going on with the patient in a well-rounded way. But I've had patients who began using cannabis say they have strengthened their spiritual practices, mostly in the form of yoga or Tai Chi or a practice of that sort, or even meditation. And one thing about meditation, you don't have to sit with as this young lady in the slide is, sit with your legs crossed and whatnot to meditate. Meditate is connecting with your inner spirit, your inner being. So when you utilize the gifts that you have, you're in your element, you're connecting with your inner being. Singers, there's some beautiful singers that when they sing, you can just feel it all the way to your soul. And they are meditating. They are connecting with their inner being. So if you use cannabis as a part of your treatment program to manage side effects or even as a wellness regimen, try incorporating some of the things that I've spoken to you about today into your lifestyle, because the cannabis plant is truly amazing. I thank you all for allowing me to speak for a few minutes. Those are the references from the information I derived, so you all can look them up and read these papers for yourself.
Beautiful. Thank you, Dr. Wilson King. And we will have all of these decks for our community, if it's okay with our speakers, on her library. So that way you could actually watch the recording, but you can then also go back and see the slides as well. All right, I am going to bring all three of our panelists together. You can see how robust this presentation was because it touched on so many different aspects. And I think with Unite for Her too, we know that it's not one size fits all, and that it's a combination of things that allow us to get that complete healing emotionally and physically. So I was just so happy on how this all laid out and just so impressed with your work. So thank you all. I am going to start getting into the questions. Dr. Sulak, I'm glad that you'll be able to put some of your website information there on in the chat. Please feel free to do the same, Dr. Park and Dr. Wilson King. I know that we had a couple questions right in the beginning, and this one was from Connie, and it said, how do you use the liquid tincture? I bought a bottle and I'm not sure how to use it. We'll start there. And who would like to take that one?
Well, I'll jump in. So there's so many different bottles that could be vastly different. So I'd say step one is understanding what you bought. And that includes, usually just to keep it as simple as possible, how much CBD and how much THC are you going to get out of a single serving? And what is that serving? Is it one drop or is it one dropper full? Literally it can range from like 1 milligram of THC per drop to 1 milligram for a whole dropper full. And some products could even be stronger, in the other direction. So once you figure that out, I would say a safe starting dose for THC is usually 1 to 2 milligrams. That's a dose that's very rarely going to cause any negative side effects. It's also a dose that in most people isn't going to cause any pronounced benefits either, but that's a good place to start, 1 or 2 milligrams. And with CBD, you can be a little more liberal, 5 or 10 milligrams.
Great. Thank you, Dr. Sulak. From Heather, she had said, can someone please discuss the role of cannabis product RSO in cancer? We've heard a lot of that in our community for sure. So I will defer to the panel. Who would like to take that one?
Dustin, you can take that because I'm not a big fan of RSO.
Okay, yeah, so RSO. So this is an acronym for Rick Simpson Oil, which is named after a Canadian activist who probably 20 years ago started promoting the use of very high doses of cannabis to cure a number of conditions, including cancer. It could be called hash oil. Sometimes very misleadingly, it's called hemp oil. So be careful because that's not hemp seed oil. FICO, full extract cannabis oil. It has a lot of names, but it looks like a syringe full of a dark tar-like material, and it's extremely potent. This would be the #1 reason why someone accidentally overdoses with cannabis and has a very bad experience, especially someone, what I often hear the story is a patient gets diagnosed with cancer, a friend of a friend who knows about the diagnosis gives them a syringe of this really dark tar-like stuff and says, start with a half of a rice grain. Now, it's impossible to get a half of a rice grain or even to know what that means. And just a half of a rice grain could have 30 milligrams of THC, and I'm talking about starting at 1 or 2. So but what it really comes down to, like, how is it effectively used? Some people can very gradually build their tolerance to the negative effects of THC. So this might be taking a little more and a little more and a little more each night. And if they do that gradually enough, believe it or not, a person could tolerate hundreds of milligrams of THC without any negative side effects. And it's thought, not necessarily by myself, but out there, in the world of cannabis evangelists, it's thought that kind of getting as much THC as you can possibly tolerate or afford into you is a good idea to do if you have cancer. And I will tell you that for some people, it is a good idea. There are cases where doing this exact thing has resulted in the cancer stopping growing or even reversing and receding and sometimes even a full remission. I've seen it in my practice, but what I was alluding to before is that it doesn't happen all of the time. It's far, far, far from a sure bet. So be really careful with the RSO.
Yeah, and all RSO is not the same across the country and in different dispensaries. They can call it RSO, but it is not the same. So really check the label to see what's in what you're using, and be careful. If you do overdose, just know you will not die. You may feel like you're going to die, but you won't die. Just go to sleep. When you wake up, you'll feel fine.
It's amazing. This, you could take 1,000 times the dose that we recommend by accident, and you will have no brain damage or kidney or liver damage. These are non-toxic compounds, but they can make you feel miserable for a day if you overdo it.
Great, thank you. We had a couple questions come in via our website, so I'm going to ask both of them now. And one was from Justina. She says she has metastatic HER2-positive breast cancer and currently on a first line of treatment that is working well, but she's having a really difficult time finding information on medical marijuana and how it would interact maybe to her treatment meds. Do you have any sources that can tell her that? She's on Perjeta and Herceptin and has bone and liver mets. And she's looking for bone pain relief as well as an occasional neuropathy outside of prescription drugs that she's currently taken.
Well, I'll just start that cannabis is there in most drug interaction checkers, and you can usually put in THC and CBD. And one of the reasons for that is that both THC and CBD are present in FDA-approved medications. There's a THC pill called dronabinol, or Marinol is the brand name, and there's a CBD epilepsy drug called Epidiolex. So you can check to see if there's a negative interaction, especially in terms of how these drugs are metabolized in the liver. I will say that this is controversial, but there is a signal from human data that immunotherapy of a specific type, the PD-1 immune checkpoint inhibitors, so this would be like the drug Keytruda, which I don't think is used very often in breast cancer, but cannabis may be contraindicated in combination with these types of treatments. The reason why is that cannabis is a great anti-inflammatory medication. This is the purpose for which a lot of people use it. And the mechanism of action of these immunotherapy agents is to increase the activity of the immune system. It's actually designed to increase inflammation. So you might not want to use an anti-inflammatory at the same time because it could block some of the beneficial effects of that treatment.
Wonderful, thank you.
One other thing about using cannabis and you're on other medications is I generally recommend to patients to take their cannabis 2 to 3 hours before or after taking any other medications, which will limit the interaction. But Dr. Sulak is absolutely correct about some of the immune chemotherapeutic agents.
And I'll just add one exception that people should keep in mind is that cannabis works very well in combination with opioids. It'll actually make the opioid drugs stronger in terms of their pain relief, but not stronger in terms of their negative side effects. And so by taking them together, people are usually able to use fewer opioids, or the opioids that weren't being very effective become effective when they combine it with cannabis.
Okay, wonderful. Thank you. There was another question that came in, and Dr. Wilson King, I sent this to you, and I just thought I would put it out to the audience because I thought it was a good one. So Jessica was asking that she knew that the medical marijuana was such an important one, and she felt like she's heard that it's estrogenic and that they should not use it. She's been overwhelmed a little bit about understanding that, and wanted to see your thoughts on it.
Well, yes, there was and Dustin, please correct me if I'm wrong. There was an old study that thought that THC would synonymous with an estrogen receptor beta, and that would enhance breast cancer. But studies by Dr. Christina Sanchez has debunked that, and it's found that this is it's not contraindicated. It doesn't feed the tumor. That THC is cancer reducing, does kill cancer, does kill breast cancer cells. She proved that in 3 or 4 studies, I believe it was. One study she used the Aunt Zelda's products and which are a combination of artesian formulas, and the breast cancer was decreased, all types, the HER2 negative, the hormone sensitive breast cancers, HER2 positive, and then again, of course, the triple negative breast cancer. It worked in all of them. They found that the THC and THC-rich cannabis oil offered some hope in improving treatment outcomes. And the triple negative breast cancer is a highly aggressive cancer. So if you're interested in using it, please consult a cannabis expert first.
And I would just add, like, we have to be aware of what we don't know. So if anybody comes to you and says, here's a type of cancer for which you should never use cannabis, or if somebody says, here's a type of cancer that cannabis always kills, neither of those stories is going to be right. We started hearing these rumors about it's good to use cannabis for every type of breast cancer except estrogen receptor positive breast cancer. This was, I think, back in 2016 or 17, this started circulating, and I was wondering what the heck is going on, and traced it. It was like a serious detective story to try to figure out how this spread on the internet and where it came from. And yeah, there was one little like preclinical, not even a rodent study, I think a cell-based study where there was some activity at a estrogen receptor subtype, like Janester mentioned. And then there was one rodent study that involved breast cancer, with two types of breast cancer cell lines that did not contain any of those cannabinoid receptors. So basically, these cancers were not sensitive to the anti-cancer effects of cannabis because they didn't have those little cannabinoid antennas on them. And when they treated these rodents with really high doses of cannabis, what they found was that the cannabis suppressed the immune system to some extent, which it can do. It's an anti-inflammatory, and part of its immune suppressant effects at these high doses included some of the body's own natural anti-cancer defenses, and it did not kill the cancer. So you suppress the immune system and you don't have a negative effect on the cancer. And guess what? The cancer starts to grow a little bit faster. And I think in that study, it was two different types. One was estrogen positive, and I think the other was triple negative, but it doesn't matter. Like, you cannot take those results and extrapolate it. So this is a really good case in point for people hearing things. And hopefully me telling you that story will help you kind of see through or cut through some of the incomplete information that might be out there.
Yeah. Don't guide your therapy and what you do based on what you hear. Find an expert, get the articles, read the information for yourself from reputable sites. And I did send, I believe, the link to an article on Project CBD about THC and breast cancer. So you can get a nice amount of information on that.
Wonderful, thank you. We had a couple of questions just on measuring. So if you could just tell us, on the tincture dropper, does it measure ml? Like, it measures ml? Is that the same as mg?
No, definitely not. Great question. So, yep, milliliter, ml, and that's if your dropper is graduated, which would be nice. But a lot of times they don't even have little lines on them. But ml is going to be a measure of volume. So how much of the oil, how much volume of the oil are you taking? And then mg, milligrams, that really depends on the potency. So somewhere on the package, it may say this contains 10 milligrams per milliliter. And if that were the case, then one full dropper, which is usually 1 milliliter, that will give you 10 milligrams, or a half dropper will give you 5. The problem is the labeling in the cannabis industry is terrible. And most of these products do not tell you the potency. If you're lucky, you can find how many milliliters are in the whole bottle, how many milligrams are in the whole bottle, and bust out your calculator and see if you can figure it out. It's dangerous.
Yeah. One of the things I do in my office is I give examples of how to calculate your dose if you're using a tincture. And if it's a 300 milligram bottle and there's 10 milligrams per ml, then that's what you do. So I let people know how to calculate and give examples so they can know a quarter of a ml, half an ml is this, and go from there, because you have to know math, and some of us are far away from that and haven't used those skills since calculators were created.
Yeah, I'm with you. All right, we have another question. It was asking, is an oral intake safer than an inhaled one because of the possible carcinogenic effects in lungs or smoking cannabis? Is vaporized safer than smoking a joint?
Oh, man. In regards to cancer, well, a vaporizer is probably the safest way to take in cannabis, just because of it doesn't heat the flower, the cannabis plant, it doesn't burn it. It doesn't make it, take it to high temperatures. It just forms a mist, and you can inhale it that way and get more of the plant, of the phytoconstituents, the terpenes, the flavonoids, and things like that. When you smoke, you cause combustion, and the smoke in and of itself is carcinogenic. But with smoking cannabis, there was a study, I believe it was Donald Taskin, who did a study looking at heavy cannabis smokers and heavy cigarette smokers, and cannabis smokers far less incidence of lung cancer as opposed to smoking cigarettes. And the belief was that the cannabinoids provided a protective effect in the lungs. However, smoking smoking cannabis or cigarettes still gives you the respiratory diseases, chronic obstructive pulmonary disease, bronchitis, and things like that still occur with smoking either cannabis or cigarettes. So smoking, not the safest, but it's not necessarily carcinogenic, smoking cannabis, that is. Oral is totally different, and it goes through the liver and it creates a more potent THC compound and gives you a different type of high. Some people like to say it gives you a body high as opposed to a head high. Okay, I don't know that everybody feels that difference, but it is a different type of effect. So it's oral is safe, smoking, vaporizing is safe. Smoking, you have the issues with bronchitis and whatnot. Tinctures are what I love. Tinctures are simple, you don't have any equipment, they don't cause an odor. You can do it around a lot of people and they didn't even know you're taking cannabis. So so that's kind of the take on that.
And I just want to point out, like, it really depends how much you're smoking. Don't be afraid to try it once. It's not going to hurt you. I mean, you know, you might cough. It might actually be slightly painful if you take too big of a hit or something like that. But, you know, some people live in areas with clean air and some people live in, you know, urban areas with smog. It's maybe all relative to the context of our lives. But I've just had enough patients over the years, patients with cancer and with other conditions, tell me that nothing provides the rapid and effective relief the same as the smoke. The vaporizers might come close. Taking a tincture is wonderful, especially if you can prevent, you know, get ahead of the symptoms, take it beforehand. But if you're feeling sick right in the moment and you want to feel better a few moments from now, sometimes a good hit of that pipe is the best thing.
Great, thank you both.
Good point, good point.
Yeah. There was a question here about studies and research, and you know, we hear a lot about cancer, but do we hear any on ovarian cancer? Any recommendations for ovarian cancer?
It's very minimal, very, very minimal. We're trying. There was one study that really didn't say anything. I don't know. Dustin, you may know about.
I'm pulling something up now. You know, what comes to mind was a survey study of women with gynecological, I'm trying to remember if it was conditions or cancers, but it might have been just conditions in general.
It was gynecological cancers. I remember that study, but it didn't have much to say about ovarian.
I think it's, you know, in general, you see the same thing when you do these survey studies of patients using cannabis to treat a various condition. Most of them tell you that it's helpful, like, you know, whatever context you ask it in, including people with cancer. You know, usually there's somewhere between like 50 and 90% of people say it's something that helped them and that they want to continue using.
Certainly can help the side effects from chemo. It certainly can help you feel better. But as far as treating the ovarian cancer, we don't know, and it doesn't hurt to try.
Yeah.
I did find this. I'll put it in the chat.
Okay, because is it the one from 2020?
There was, I've got one from 2021 and one from 2019.
Okay.
And Dr. Wilson King, you talked about a link and I wasn't able to find that. I don't know if you can grab it and put it in the chat as well. That would be great.
Sure.
Our audience. One more question I think I'm going to take here, and that is, you know, any drug interactions of cannabis with aromatase inhibitors?
So potentially, yes. You know, like any drug, first of all, that they say don't drink grapefruit juice with, there's a potential interaction, especially with CBD. And I say potential, but the enzymes in the liver that break down THC and CBD are the same enzymes that break down a wide variety of other drugs. This is why Dr. Wilson King is saying you don't necessarily want to take them at the same time, because they're going to go to the liver at the same time and be competing for these same enzymes that are going to process them. However, I think that these drug interactions, the evidence that we have, it suggests drug interactions are going to be relevant only when people are using very high doses, or we could at least say moderate to high doses of cannabis. So a lot of it is theoretical, and a lot of other things, other drugs are interacting, dietary things like grapefruit are interacting. So I don't want people to get, very paranoid about it. But if you're especially using a high dose of cannabis, again, go to the drug interaction checker and take a look. I know that like Arimidex is, I think that hits every CYP enzyme that cannabis, is processed by. So you want to be careful, but not paranoid.
Right.
Great.
It doesn't
That's why
mean
I
that
use-
you
that's
can't-
why
it
you-
doesn't mean you cannot use cannabis. That's what I really want to get
Right.
to. Like
That, yeah, that's
if
why
you-
I say, instead of giving specific medications, don't take it with this, just 3 hours, 3 hours apart from taking any other medicine, 3 hours before, 3 hours after, and you'll be okay. You
Right.
should-
Yeah. There was one of our participants asked, she's seen these honey sticks with CBD. And do you find that to be an effective way to use CBD, especially for anxiety? And I've just seen CBD in everything now, like it's just in everything. So I guess it doesn't matter if it's honey sticks or, yeah.
Yeah.
I think like Kim pointed out, these products are mislabeled all the time.
Oh, yeah.
Every peer-reviewed and investigative report that looks at CBD products out there in the marketplace, it's usually half or more don't contain what they say they contain.
Right.
So, you get a medical kind of quality product. If it has a certificate of analysis on the honey stick, then maybe you can trust it. Look at the date, make sure there's a batch. It really depends on who's making it.
Right.
Yeah. Thank you, Jess. Okay. One more, and we'll stop with this one. Okay. Can you estimate what a high, moderate, and low dose, or is that a person dependent? Can you estimate what a high, moderate, and low dose is, or is it?
That's different for everybody. A low dose for me may be a high dose for someone else. A high dose for Dustin may be a low dose for Kim. It depends on the individual, how cannabis experienced you are, what your endocannabinoid tone is. There are individual differences, and that's what makes cannabis so beautiful. You can adjust it to you and find a dose that fits and works for you. And it's a trial and error, it's a titration. There's Kim talked about it in her talk. So it's different for everybody. A veteran who has PTSD, who has been using cannabis, may use 50 milligrams a day. I wouldn't be able to function with 50 milligrams a day. I'd be in bed all day, every day. So there is no, this is high, this is low, this is moderate. But one of the things you can do is, if your dose is a little too high, you may develop tolerance for it, and it may, after a while, not work as well. So what you do, and this is on Dr. Sulak's website as well, it may seem like the two of us are fan club members of Dr. Sulak. We really respect him, but he really has a lot of information on his website.
Absolutely.
Mm-hmm.
But he can talk to you about it. You can go to his website and find out more about the dosing. We do love him dearly.
Thank you. Thank you both.
Well, so
Yeah,
does
I
our
think
audience.
maybe this question, was coming back at me when I said, if you're using a low dose, you might not have to worry about drug interactions. So if you want me to give you a firm number on that, I would, even a conservative number, 30 milligrams, I think it's going to be really unlikely to see a drug interaction with someone taking less than 30 milligrams of cannabinoids in a single dose.
Wonderful. Well, if you get a chance to look in the chat, you're going to see our audience was so impressed and just a wealth of knowledge. And I'm glad you all put your websites in there. I'm sure there's a way that anyone could contact you if they wanted to through the website. If there's anything else you'd like to put in the chat, please let me know and do it now. We'll have this as a recording. But thank you so much. It was just so informative. And I love the approach of just, giving us so much information from different perspectives. Incredible. read the chat, appreciate all of you. So thank you all for coming.
Thank you, Sue, for the
Thank
invitation.
you for the
You got it.
invitation. And thank you, Kim, for inviting us as well.
Thank you
Yes,
for coming, and thank you for
thank you, Dr. Park.
being part of it. You're welcome.
Yeah, it was such a wonderful evening.